Good afternoon, everyone. My name is Kyle. I'm coming here today from all the way from Los Angeles, so I think I had the longest commute. I'm here today to talk about something that I feel deeply passionate about, and that is increasing human health span. Now, health span is something that is the number of years in your life, or the amount of time in your life that you are considered healthy. And so I've been trying to solve this problem of health span with two different companies now, and I've been taking completely different approaches. And let me explain to you today how I approach this problem. So we have benefited greatly as a society over the last century from this biotech revolution. And things that we can all agree on have gone really well, like we've reduced mortality rates for mothers 98% from 1900 to 2000. We've completely eradicated measles, mumps, typhoid, whooping cough, diarrhea, and thousands of other infectious diseases. But along the way, we forgot about one important thing, and that is nutrition. We became so consumed with curing disease with pharmaceuticals that we lost focus of how to prevent disease. So now the CDC says we're being plagued with lifestyle diseases. And they're responsible for 4 out of 5 deaths in the United States and 40% of cancers. But when I hear lifestyle disease, I think preventable disease. I think sedentary lifestyles, unbalanced diets, and toxins in our water and our environment. Now, I don't believe that this is the fault of medical doctors. Medical doctors will tell you themselves, 85% of them feel inadequately prepared to talk to their patients about nutrition in any amount of depth. Nutrition just simply wasn't taught in medical school. There's less than 24 hours of coursework on nutrition in medical school. So here we are in 2017, and we have 117 million people in the United States living with one or more chronic health conditions. That's 1 in 2 adults. Life expectancy actually fell last year for the first time in over a decade. And at our current pace, the CDC predicts that 1 in 3 people will have diabetes by 2050. That's our children. Unfortunately, nutrition is one of the many specialties that is often mishandled by conventional medicine. Some of the other areas include fertility and allergies, skin condition, digestive issues, hormone imbalances, fibromyalgia, chronic fatigue, autoimmune diseases, and a big one is mental health. These are all patients that are often fall through the cracks of the medical system. So the harsh truth is that the practitioners that are best equipped to handle some of these conditions are not necessarily medical doctors. More frequently, they are integrative doctors. They could be functional MDs, they could be doctors of osteopathy, they could be naturopathic doctors, they could be chiropractors or acupuncturists or fertility specialists. So over the last few years, what we've seen is some of the nation's largest healthcare systems start integrating more complementary and alternative medicine practices into the conventional medicine. Now, most of these systems or most of these clinics are private pay, and they use natural health and wellness strategies to complement, but not necessarily replace, what's going on inside the hospital. These practitioners take into account the whole person and address the root cause of these chronic symptoms and work to treat them naturally. The most recent grant was actually right here at the bottom. UC Irvine, a few weeks ago, received a $200 million grant to start a Center for Integrative Health. So this is happening, and the nation's top health systems are taking notice. So I know what you're thinking. This is a bunch of quackery. It's a bunch of pseudoscience. It lacks evidence. Naturopathic doctors are not real doctors. This isn't real medicine. And for a while, I felt the same way. See, I come from a world of conventional medicine. On our last company, Cedars-Sinai, we worked very deeply with Cedars-Sinai. They actually invested in our company. We worked out of the hospital for months. My co-founder of my company is getting married to an orthopedic surgeon. So conventional medicine has always been a part of our daily lives. But consider this. A primary care doctor spends about 13 minutes with a patient and prescribes prescription drugs after 80% of visits. An integrative doctor will spend an hour or more with the patient and prescribe drugs in less than 15% of the time. So my personal belief is that the reason that there is so much hostility toward alternative medicine doctors is because they don't sell enough prescription drugs. There's 4 billion prescription drugs passed out every single year. That's 1 per adult per month for their entire life. I think that's too much. And again, this is not the fault of medical doctors. A lot of them lack the financial incentives to spend any more time with their patients than they are. But let's stop pretending that this is actually better medicine. So our quality metric on prevention is actually very poor. And that's the problem that I'm looking to solve. So last December, my co-founder and I were put in one of the most challenging situations that founders could ever find themselves in. We had raised $23 million for a non-medical home care company called Home Hero. And we were providing non-medical caregivers. We were one of the largest non-medical home care providers in California with over 1,500 caregivers. And we were forced to shut down the company due to some regulatory challenges. The Department of Labor had basically ruled that all home care workers had to be licensed, they had to receive overtime benefits, and full employee benefits. And so the change made the economics of our business completely untenable, and we were forced to shut down. The silver lining is that we had the opportunity to take the remaining capital and go in any direction that we wanted, and we decided that we wanted to continue fighting for better health care in the home. And so we decided to go after the lowest hanging fruit in health care. And it was the millions of patients that were falling through the cracks of the conventional medical system and being failed by conventional medicine. So one of the conversations we had was actually a co-executive of ours, his name was Lane, who is no stranger to being betrayed by people he trusts and institutions he trusts. He grew up as an orphan in the state of New York, and he grew up into the world of finance, and for years he would go to his primary care doctor and complain about chronic fatigue. And for the longest time, they tell him he has nothing to worry about, and he kept getting passing letter grades at all of his physicals, until he went to an integrative doctor, and they found excess levels of mercury in his body and a wide array of nutritional deficiencies that were affecting his energy and his mood and his sleep. And he felt totally betrayed. For years, different doctors, multiple doctors, had told him he's totally fine. Similarly, my own girlfriend, who's qualified for Boston Marathon twice, went to an integrative doctor, and they found such high levels of household toxins in her body that they asked her if she worked near jet fuel or on an assembly line. She says, "No, I'm in great health." And so we started to observe that there were thousands and thousands of patients that were taking pharmaceutical drugs for basic things like eczema when their body was just reacting to a gluten allergy or a hormone imbalance or a gut sensitivity. And the list goes on of patients that were misdiagnosed or not diagnosed at all. So we wanted to empower people to find more natural and holistic remedies to these chronic health conditions, and build a safety net under the medical system as patients fell through. The most frustrating thing about our last company with Home Hero and dealing with the geriatric community is that we were getting patients at the sickest of their sick. We were finding patients that had made poor diet and lifestyle choices back in their 20s, 30s, and 40s, and they were on hospice at 70 years old. And so what we wanted to do is rewind the clock and help patients at a much earlier age make healthier decisions about their life. And so we pivoted, and we created a telehealth platform for integrative medicine called Harvey Health. It was named after William Harvey, who was an English physician who first discovered how blood circulated through the body. What we do with Harvey is we provide video consultations with integrative doctors. They can be naturopathic doctors, doctors of osteopathy, or functional MDs. We provide advanced specialized lab testing and natural treatment plans all from within the home. We'll even send a phlebotomist or a technician to the house to draw blood, in events that it's necessary. So patients can go through the entire integrative medicine process without leaving their home or their work. And the idea here is to really combine philosophies of prevention and natural self-healing with the clinical side of lab testing. And if we can do this, and if we're successful, we will increase the access, the awareness, and the affordability of integrative medicine nationwide. So that's Harvey Health, and that's what we're trying to do. So look, I'm going to have the shortest message of anyone here today, because I think this is really, really important. The first is I want to challenge the medical community to fund more longitudinal studies that explore the relationship between chronic inflammation, specifically around nutrition choices, toxins in the environment, and lifestyle choices with chronic disease. Look at these studies. The second is I want you to incorporate more whole body health metrics into your quality scores, ones that better reflect human health span and take into account the whole body. The third is I want you to welcome integrative medicine practitioners into your health communities. These can come into the form of naturopathic doctors, dietitians, nutritionists, mental health specialists, chiropractors, acupuncturists. Give them a seat at the table. Talk with them about evidence. Talk with them about science. Talk with them about best practices. But also, listen to them. Listen to them when they talk to you about nutrition, when they talk to you about prevention, when they talk to you about mental health. If you can do these three things, you will help integrative medicine become synonymous with medicine and put us all on a path to better health. That's it.